My name is Nina Marino, and I'm the Director of the Office of Child and Family Services at the Department of Behavioral Health and Developmental Services. I would like to welcome you all to the 2021 Children's Mental Health Awareness Day celebration. You are the caregivers, advocates, parents, and policymakers who work every day to care for and improve the lives of children. The National Substance Abuse and Mental Health Services Administration sets aside the first Thursday in May to emphasize that positive mental health is essential for child's healthy development from birth through young adulthood. This day gives us the opportunity to renew our commitment to prevention of mental health issues before they develop in children, intervening as early as possible with children who might be at risk of adverse childhood events, traumatic stress, or other developmental factors. And we know that 1 out of every 5 children experiences a mental health issue in any given year, and 1 out of 10 of those children will have a severe mental health issue. But when treated, children and adolescents with mental health problems fare better at home, in school, and in their communities. And yet we know that 75 to 80% of children and adolescents in need of services do not receive them due to a myriad of factors. Those include things like stigma, lack of access, and difficulty navigating a complex and confusing service delivery system. One of our greatest challenges is the inconsistent array of services across the Commonwealth that is often based on zip code. We're working to address the access and consistency of services by creating a standardized continuum of quality behavioral health services for children and adolescents across the state. The Systems Transformation, Excellence and Performance in Virginia, or STEP VA, is one such initiative with our public mental health system that requires uniform access to critical services across the state, along with same-day access, primary care integration, and care navigation. We're also working closely with our Medicaid agency to create new services that Medicaid will pay for that are specifically targeted at keeping children in their homes and communities, which we know is best for families. And other areas of progress include improved access to crisis services through mobile crisis, which allows us to come to wherever the family would like at the frequency and schedule to meet the family's needs in order to intervene in crisis situations earlier on. We're working on evidence-based practices for treatment, which will increase the involvement of families and children in the treatment process by giving the families more voice and choice, and increasing things like family and youth peer support partners in treatment. And over the past couple of years, we've partnered with pediatricians and family practice doctors from across the state to enhance the training that they receive in behavioral health issues, and also to provide them with more access to child and adolescent psychiatrists, licensed mental health behavioral professionals, and care navigators, all to assist the doctors and the families and helping everyone where they feel most comfortable, which is often first with their doctor. So we know this year's created additional mental health challenges for youth and families due to the COVID-19 pandemic. And we know that families have struggled with childcare, virtual schooling, personal safety with the virus, economic insecurity, and the continued demands of work and family life. And so with that in mind, we have chosen resilience in the times of adversity and uncertainty as our theme for this year's Children's Mental Health Awareness Day recognition and celebration. Unfortunately, we're still unable to host face-to-face events, so we decided to develop a series of 5 videos that will reflect our theme based on feedback we received directly from families last year on what they would like to see for Children's Mental Health Awareness Day. So here's a sample of the topics for you guys to enjoy. Nurturing family resilience through support and Formed Families Forward and the National Alliance of Mental Illness, or NAMI. Coping with uncertainty using mindfulness and yoga with Project Yoga of Richmond. Resilience, promoting the mental health of youth and young adults, presented by Youth Move at NAMI. Build your resilience in the face of crisis, presented by family and youth support partners and behavioral health professionals at Middle Peninsula Northern Neck CSB. And the impact of racial trauma and resilience, creating solutions, presented with Voices for Virginia's Children, Greater Richmond Scan, and Safe Haven Space. So we hope that you will find these videos helpful with practical strategies and solutions. Please share them as you would like and watch them at your convenience. And as always, we will continue to partner together to help our young people and families have the best opportunity for success and abundance in their lives. Thank you.
So welcome everyone. My name is Sophie Fontaine and my dog is barking in the background. My apologies. Today I will be discussing resilience and how we can promote that in the mental health of youth and young adults, both as peers and providers. So a little bit about me, and about NAMI Virginia and Youth Move. My name is Sophie Fontaine and I am the Youth and Young Adult Program Coordinator at NAMI Virginia. I've been there for about a year now. I'm also the Program Coordinator of Youth Move Virginia. Just a little bit about NAMI. NAMI is the National Alliance on Mental Illness. We are a 3-tiered mental health organization that was founded by parents of children with mental illness that sought support and resources from one another. Our mission at NAMI Virginia is to promote recovery and improve the quality of life for Virginians living with mental health conditions through support, education, and advocacy. NAMI Virginia has 14 local affiliates across the state of Virginia, as well as 2 statewide networks, the Virginia Family Network and Youth Move Virginia. Youth Move Virginia's mission is to support a grassroots peer network for youth and young adults to be empowered, active guides in their own care while advocating for mental health policy and programs that are specific to their unique needs and experiences. So resiliency is something we've heard a lot of lately, especially in 2020. Resiliency is defined as adapting in the face of adversity, trauma, tragedy, threats, or significant sources of stress. Resiliency can look very different for people, but depending on age, race, and where their communities are and more. And resiliency looks very different. You see on this slide, I have a lot of different ways that resilient people have the ability to set and move towards realistic goals, look long-term, accept changes as part of life, engage in active decision-making and self-discovery, communicate and problem solve, actively learn new things, have a realistic perspective of themselves and the world, accept and manage the presence of strong feelings, have a positive self-view, actively engage in self-care, and build connections with others. In some areas that make youth and young adults practice resiliency are school. Think of the first time you failed a test, and when you remembered that your next test, how bad it felt to fail, and you were like, I'm not going through that again. Jobs, if you've ever been fired or had a coworker or a boss you didn't get along with. Social life, think back if you've ever had a first day at a new school or if you moved to a new city. Mental health challenges, social justice movements, if we think back to last summer, the uprisings in our entire country. And COVID-19, young people have bore the brunt of most of the pandemic. We've lost proms, graduations, weddings, the job market crashing, and just in general, our sense of normalcy, whether it's in school or in jobs. So resiliency is a very abstract term. So at Youth Move Virginia, we use the 7 C's of resiliency to break down what resilience is. And also I wanted to give you all some tips and advice on how we can foster it in ourselves as peers, with our children, with our students, and with patients. So you'll see on this slide, I've got 1, 2, and I've got more, but you'll see on the bottom bullet point that I have examples of how we can develop these skills. So number 1 is competence. Competence is defined as the ability to know how to handle stressful situations effectively. When we have a difficult experience, we are more prepared to take care of ourselves or others if they're going through it. You're also able to share that personal experience with others to help them if they ask for help. We also feel more confident when we are encouraged in our own growth and understanding. Competency and resiliency go hand in hand when we are encouraged to trust our own judgment, make responsible choices, and face difficult situations. However, being competent does not always mean we get it right. So ways to do that is by sharing personal stories. If you're a parent or a teacher or anything, and you've been through a similar situation as someone that's in front of you, share that. Let them know how that felt for you, because that sense of normalcy will make young people feel more accepted and also more comfortable sharing if they're struggling. Number 2 is connection. Connection leads us to have a strong sense of security and belonging. Connection doesn't just have to be with other people. It's about feeling connected with a community, a religion, a culture, anything. Connecting with others on a variety of levels also prevents destructive behaviors. I'm sure we've heard of positive peer pressure. The people we're connected with, if they encourage us to do positive things, we're more likely to do that. Ways connection can be fostered would be in empathy, creating a community, and encouraging yourselves and others to be your true self. Number 3 is contribution. We contribute to the world and it's a better place because we're in it. We all have a part in this world and we all bring unique features to the table, and we can use our previous experiences to help others and ourselves through more difficult events. Contribution gives us a sense of purpose, a motivation to act, and helps us learn how to improve the world. Contribution doesn't just mean physical acts, it can be how you made someone feel, something you did for someone, anything. Young people have historically contributed to major social justice movements. Like I said earlier, last summer is a perfect example. And if we even want to think back to the civil rights movement in the 60s, mostly led by young people. You can foster contribution through giving a sense of purpose, motivation, and being part of giving back to the community around you. You'll notice that a lot of these 7 C's build on each other. And it's just a great way of kind of being able to remind yourself of where you're at and trying to encourage others. Number 4 is coping. Coping is defined as facing and dealing with responsibilities, problems, or difficulties, especially successfully or in a calm and adequate manner. I know last year coping was a hot word because we were all coping with something none of us had ever dealt with, a global pandemic. So when we have a wide range of coping skills, we are able to effectively manage challenges. As we have gone through difficult situations, we are better able to manage and cope if they come up again. We can foster coping by helping to develop new coping mechanisms, encourage them when times are difficult, and diversify coping. I know for me, I am a very social person. Coping for me is going out and being with people, and that wasn't an option last year. So I spent a lot of time trying to just, connect with people online and, getting to do fun programs like this. Number 5 is control. So control is the power of influence to influence a course of events. And if 2020 taught us anything, life can feel super out of our control at any time, and that makes us feel not so great. When we are in control, we are able to make choices that can better help us bounce back after a challenging situation. At times, though, it can be hard to really know what's in our control and what isn't. As young people, it can often feel like a lot of situations are out of our control. Personal stories that we have heard from people include struggling to feel in control around adults in their medical treatment and more. Resiliency and control go hand in hand because we are able to better know the consequences of our decisions, and we can empower ourselves to do what works for us. Encourage control by challenging anxious thoughts, allow decision-making in difficult events, and encourage critical thinking. And by that, I mean, if somebody's upset and I don't think I did anything wrong, it's that struggle of, well, is it my fault that this person feels this way or not? So challenging those anxious thoughts, critically thinking about what happened, how I helped, what I could do differently, and things like that. Number 6 is character. So character is the mental and moral qualities distinctive to an individual. When we have character, we are better able to have a strong sense of self-worth and confidence. We are also better able to be in touch with our values and comfortable sticking them. Practices that enhance character include enhancing self-esteem through strengths-based work, caring for others, and determining your values. And strengths-based work is I feel like it's more of like a hot topic now, but it's definitely something that we're trying to use. And as a social worker by practice and trade, I can tell you that strengths-based work is the best. And one of the best ways I think parents and adults in the room can kind of encourage character and strengths-based work is asking young people what they're good at, what they think, what they like, what they don't like, and giving them that sense of, oh, good, so you really like art. I'm going to encourage them liking art because art's a great outlet for people. It's a wonderful tool. And our last building block is confidence. So confidence is a belief in one's abilities, and it's rooted in all of the other building blocks we've discussed. We are able to become confident when we can demonstrate our skills or character in real situations. Resiliency and confidence go hand in hand because when we have been through a difficult situation and learned how we can best manage, we are able to feel more confident if that situation or something similar occurs. Encourage confidence through encouraging decision-making and empathy, being a cheerleader, trying new things, and learning how to fail. Confidence doesn't mean we never fail. It just means that you have faith that you can succeed. And I know that can be difficult sometimes. Coming from a young person that struggles with confidence, learning how to fail was probably the hardest thing for me. And as a perfectionist, I'm very grateful I learned how to fail. So I wanted to also touch on the topic of toxic positivity. I'm not sure if a lot of people have really heard this word, this phrase, but toxic positivity, I'll give some examples. So toxic positivity is everything happens for a reason, or look on the bright side, or finding the silver lining of situations when someone is very, very struggling. There's a wonderful video by Brene Brown called Empathy. And she talks a lot about how empathy and sympathy are different, and empathy fuels connection and sympathy drives connection. And an example she uses is that one of the characters in the video had a miscarriage. And one of the people who's trying to use sympathy says, well, at least you can still get pregnant. That doesn't really take away the pain that that person's feeling of a miscarriage. So toxic positivity is defined as the excessive and ineffective overgeneralization of a happy, optimistic state across all situations. The process of toxic positivity results in the denial, minimization, and invalidation of the authentic human emotional experience. So recognizing resilience often requires us to utilize our personal experiences, good or bad, and how those previous experiences have helped us become more resilient. However, you should never make someone have to feel positive about something that happened to them if they don't feel positive about it. A really great example is the COVID-19 pandemic. Obviously, tons and tons of people have died. However, some people have found some great things about themselves through the pandemic. So it's one of those things of forcing positivity on someone when they're not ready for it. So resilience doesn't mean you have to feel positively about bad experiences. If something happened to you and it hurt, that's it. So just a reminder, when you're trying to encourage resiliency in someone, that their experiences are valid and their feelings about that experience is valid. And we don't have to look at difficult and traumatic experiences with a positive lens if we don't want to. Feelings are very complex. So if you're struggling with understanding the difference of toxic positivity to encouragement or even just positivity, there's a lot of really great resources online. And so I also wanted to include down here some resources of just things you can do as a family unit, with friends, with really anything. So I listed here some movies that are about resilience. Number one, Inside Out. It was a Disney cartoon, amazing, definitely family friendly. And it's about a young girl named Riley whose family moves to San Francisco, and she feels like she has to be happy all the time when in actuality she's very, very sad. It's a really great movie about talking about how to encourage talking about feelings as family units with friends, things like that. And it also just showed how resilient Riley was, even though she was in a lot of pain. She got to use her pain as a positive experience. Again, her decision, not her parents. Second, Mulan. I'm referring to the cartoon version. I have not seen the live action one, but another great movie about resilience and being tough. I know we all know the Mia Man song. That's a pretty good resiliency song. Pursuit of Happiness, a little more on the teenage side. One of the most emotional movies I've ever seen. It's with Will Smith. He's a man who's struggling with homelessness, and he's just trying to, take care of his child. And there's a lot of really great lessons in that, and I think a lot of great conversations that can come of it. However, very emotional movie. My last two are rated R, so a little more adult. But Beautiful Boy is about a young boy who's struggling with a heroin addiction, and his family trying to just heal from that and trying to get him not only through recovery, but also the family through recovery. And Wild is a young woman who recently went through a divorce, and she decides to hike a really long trail. I'm blanking on the trail's name. But she decides to hike a trail to overcome a lot of pain she had of her recent addiction and come and being clean, and leaving her husband. And it's a really beautiful movie about kind of connecting with yourself again. And then just some activities to develop resilience, a values clarification activity. They are all over the internet. They're all over Pinterest. Really taking time to learn not only what values are important to you, but also the people around you, and as a family as well, or even, through a provider relationship, finding out what's important to the people you're with. The In My Control handprint, this is more of a younger kid activity, but I think everybody could benefit from it. Essentially, all it is you would trace your hand on a piece of paper, and you would write the things that are in your control in your handprint and things that are out of your control out of the handprint. And it sounds a little easier than you think, because you get into those feelings of, my friend is mad at me. Well, so there's really hard stuff about it, but I think it's a great lesson. Contribution journaling, kind of going back to what we talked about contribution as a building block to resilience. I did this recently with some of my trainees and they loved it. And it revolved around, what did I contribute in the last week? What did someone contribute to me? How did I make someone feel? What's something I would like to contribute in my lifetime? And it's a really great way to just kind of see, like, it's another reflection of values. You know, what's important to me? What do I consider a contribution? What did someone contribute to me that made my day feel better? And it's also wonderful when you're with someone and they say, you know, you really contributed to me by helping me with the dishes last week, or you said you liked my haircut and that made me feel really good. And then finally, dinner time discussion. I love this idea. I've never done it with my family, but I think it's wonderful, of starting off dinner with, I'm great because blank. And everybody goes around and they would say, I was great today because I did blank, whether it's I did really well on a test, or I made a new friend, or I got that promotion, or small things of I got out of bed this morning, because, you know, for a lot of people, especially right now, that can be a really big challenge. So I would highly recommend doing some activities like this with your family. Some of them are fun, some of them are a little more movie based, but still have a lot of opportunity for discussion. And that's my presentation. I really appreciate everybody coming on and watching. Before I go, I wanted to just provide you all some great opportunities from us at NAMI Virginia and Youth Move. Highly recommend following our 3 networks, NAMI Virginia, Virginia Family Network, and Youth Move on Instagram and Facebook. If you are a youth and young adult, definitely recommend following the Youth Move page. If you are a provider that works with children or have children with a mental health condition, the Virginia Family Network is an amazing opportunity to get connected. They do wonderful programs such as their Lunch and Learns. And actually in May, we're going to be doing a mental health month Lunch and Learn. In June, we'll be doing one about LGBTQ plus mental health for Pride Month. NAMI Virginia, wonderful. Obviously, I work for them and they're wonderful. We have our NAMI walks coming up in October. Excuse me. It is going to be a virtual walk, but it's a wonderful way to connect with people in your community, whether it's your jobs, whether it's your families, or if you want to walk in remembrance of someone. And finally, for youth and young adults, we have a lot of wonderful opportunities. We actually do a resiliency training that is for ages 14 through 29. And it's pretty much this presentation, just a little longer and some more activities, and currently online. We also have our advanced youth leadership training, which is just further along on the resiliency training of just teaching about how young people can be leaders in their communities, in their schools, in their lives, everywhere. And we also have our twice a month youth and young adult groups. You can find more information about all of those events on the NAMI Virginia website. And if you have any questions, you are always welcome to email me. And that's my presentation.